Are you taking a PPI for reflux? Medications like Omeprazole, Prilosec, and Nexium can help with symptoms, but long-term, there are risks you should know about. What's considered long-term? Anything more than 8 to 12 weeks of use. The side effects include risks to your heart, your bone, creating osteoporosis, kidney health, and infections of various types. PPIs do have their place, but they were never meant for long-term use. Let's go into the specifics about each of these potential diseases that occur. A large study just last year looked at over 2 million people, and they found the risk of heart disease and stroke to increase by 12 to 54%. Why does this happen? There's a substance called nitric oxide, which does all the good things for your heart. It dilates your blood vessels and prevents clots from forming. It lowers inflammation, but nitric oxide is reduced in its production if you're on a PPI. A study found that if you're on PPIs for longer than 2 years and you're under the age of 60, you have a 68% increased risk of fracture. This is very, very important, especially in women. Women who fracture a hip lose their life 30% of the time in the first year after they fractured the hip. 50% of the time, they never regain their ability to function as it was before the fall or before the fracture. Different types of infections are increased on a PPI. Infections of the colon, the respiratory tract, also the small intestine, specifically SIBO, small intestinal bacterial overgrowth. So why is that? What's the connection? Your stomach is a bag of acid, and the reason it is so is for 2 key reasons. One of which is that bag of acid kills organisms. So when you chew and swallow, the first place your food goes is your stomach, which is a bag of hydrochloric acid. And the acid kills bad organisms. If you're on a PPI, you've diminished your acid so substantially that studies have confirmed a very large risk of infection because you're on the PPI. Studies have shown a 50% increased risk of pneumonia, a 100% increased risk of small intestinal bacterial overgrowth, and a 73% risk of Clostridium difficile. It's a bacterial infection that can be life-threatening. So this risk of infection is very real when you're on a PPI. Chronic kidney disease is another risk, and studies have shown a 20 to 50% increased risk of chronic kidney disease and even renal failure when on a PPI. There's also been studies that don't have as substantive results, but linking to dementia and liver disease. But I wanted to list for you the categories that had really robust research, and I'll put those all in the description. The key here is to know that you have options, because I don't want you to feel like you're in the position of, great, I take a PPI and my acid reflux is better. I take a PPI and I'm at risk for heart disease and kidney disease and infections and brittle bones. It's not one or the other. You're not between a rock and a hard place. The plan C here is to get to the root cause of why you have acid reflux. Remember, your stomach is supposed to be a bag of acid. What's happening incorrectly is that pressure is being placed upon your stomach. And because it is a bag of acid, when you're squeezing it, just like you're squeezing a balloon with water in it, that pressure causes the acid to come up into your esophagus, just like if you squeezed a balloon, the water would shoot up. So it's the pressure that's the problem. Your stomach isn't being bad or wrong by producing acid. It's supposed to. That's what's protecting you against infection. Also, the other reason we have acid is so we can absorb key minerals like calcium and magnesium, so we don't get brittle bones, zinc, folic acid, vitamin B12 to protect our brain, to protect our heart. So the acid has very important substantive responsibilities that when you take the acid away, you suffer. So it's not that you have too much acid. It's not that your stomach is being bad. There is a source of pressure and inflammation. And when you can get to the root cause of that, you can stop the acid from refluxing back up, and then you don't need to worry about having to take this medication with these dangerous side effects. So there is good news here. You just need to find a clinician who's savvy in this area and knows how to get to the root cause of that for you. I hope you found this informative. If you did, like the video, subscribe to the channel, send me a comment. I love your comments. I answer all of them. Share it with a friend who you know is on a PPI or has been suffering with reflux for quite a period of time. We're here to help.